Mesothelioma cancer. Stages, symptoms and treatment. Mesothelioma is a form of cancer caused by inhaling asbestos fibers. These fibers get blocked into the shielding lining of the pleura, causing genetic mutations in adjacent cells. Stages of mesothelioma. Stage 1. The cancer is restricted to the lining of the pleura. Stage 2. The cancer has blowout to the lung itself, diaphragm, and lymph nodes. Stage 3. The cancer extends all over one side of the chest, into the chest wall, esophagus and other lymph nodes. Stage 4. The cancer has blowout into two sides of the chest, the blood, disturbing other body part and bone cells. Symptoms: stubborn dry or rasping cough, coughing up blood, dumpiness of breath, pain in the lower back or rib region, lumps under the skin on the chest, trouble with swallowing, night sweats or fever, weight loss. Mesothelioma treatment: chemotherapy, radiotherapy, surgery. Chemotherapy. Chemotherapy uses anti-cancer medications, which for mesothelioma are generally injected into a vein. Chemotherapy may be used to control indications in more progressive mesothelioma which cannot be detached surgically. The treatment may also support to decelerate the growth of the cancer. Radiotherapy. Radiotherapy is generally assumed to decrease the symptoms of advanced stages of mesothelioma. It may also decelerate the development of the tumor. Surgery. Surgery can be used to try to totally get rid of the mesothelioma. The surgery targets to remove as much tumor as possible to get rid of symptoms.
The research brought on words like terminal, hard, abrasive, aggressive, treatment, chemo, radiation, surgeries, lifestyle changes, things of this nature, and it was just hard to deal with that. The more you read, the more depressed you got. The 6 weeks went by. I even got the results back, and no, I did not tell my family. I didn't want them to know. I wanted to go and see what my options were and to try to figure out what I was going to do first before and telling them, because I needed to know what I was talking about first, and I also needed to know how I was going to react to it, so I had to get my own self together. Then realize, okay, I'm going to have to stand up, get up out of this chair, and first tell my family, which was going to be the hardest thing I ever did to do in life, and then I was going to have to start negotiating my own life.
There are several approaches to the treatment of mesothelioma. There's standard chemotherapy, which has not proven to be very effective against this particular type of tumor, but there are some individuals who obtain a response with some lengthening of life and some shrinking of the tumor with these standard chemotherapy approaches. The difficulty with these treatments is that they often produce side effects, including fatigue, nausea, hair loss, and because they're not so effective, many have chosen not to use this approach. The second main approach to the treatment of mesothelioma is surgery. There have been surgical approaches that have involved removing not only the lung, but the lining of the lung, the lining of the rib cage, the diaphragm. This is extensive surgery. But in the hands of an experienced surgeon, such as can be found at Harvard's surgical program and at the Sloan Kettering Memorial Cancer Center, there have been reports of individuals who have lived over 5 years after surgery. This is a significant finding, And although most people have not gone through the surgical procedure with resulting cure, certainly there have been some cures of the disease. More recently, there's been a new chemotherapy approach, and that is known as Alimta. It's a combination chemotherapy approach, and most importantly, individuals who have been treated with this combination of drugs have experienced a real decrease in their symptoms, whether the symptoms are fatigue, shortness of breath, chest pain, and that's very important to the quality of life that people have remaining to them once people are diagnosed with mesothelioma. There also is evidence that survival for at least a few months, longer than would occur without treatment, has been observed in people who are on this course of therapy. And when the average length of life after diagnosis is only 13 months, extension of life by even 3 months, especially if those 3 months are relatively symptom-free or with reduced symptoms, that's a significant development.